The Charleston Animal Society is 148 years old, the first animal organization in South Carolina, and one of that first cadre of 10 organizations in the country. The mission has always been preventing cruelty to animals. That's it, never has changed, preventing cruelty to animals. It started with a focus on working animals, horses drawing carriages at the time, the transportation mode, that type of thing. It's livestock, that type of thing. We didn't go into animal sheltering until 74 years later. And most of those animal organizations were all started focused on working animals, that type of thing. But when the overpopulation of dogs, particularly in cities, and the dogs carrying rabies, those free-roaming dogs, so to speak, obviously for public health and safety, the governments had to start collecting them and rounding them up and drowning them. There's a famous sketch in, I think it was New Yorker or Harper's magazine, of how the city of New York euthanized the dogs, and they gathered them all up, put them all in these cargo nets and drowned them in the Hudson River. And so that kind of propelled this movement of these volunteer efforts to, okay, well, let's try to address this overpopulation in a more humane way than just drowning the animals. Back in the 70s, about estimated 30 million dogs and cats being put down yearly is now down to about 3 to 5 million. We have 3 impact areas. One is to eliminate unnecessary euthanasia of companion animals. 2 is to eliminate the overpopulation of companion animals. And when I say companion animals, really mean dogs and cats. And then 3 is to eliminate animal cruelty. Those are the 3 impact areas that we strive towards. We approach our work in 2 projects. So we frame our work rather in 2 projects. One is what we call No Kill Charleston as a community. The other is No Kill South Carolina as a statewide community. And that's how we frame our work, and we really look at it as projects. We have roughly about 24 programs or strategies, okay, that feed into those impacts that we want to make. So for example, today, as we speak, we have about 800 animals in our system of care. This building holds about 230. So where are all of those other animals? We have most of those animals in foster homes. We have a number of those animals in Petco stores, PetSmart stores, those types of retail stores. And then we have about 150 animals down at a sanctuary down south of here. So what we're looking at doing on a statewide level is expanding this campus, basically doubling the size of it, to build a large animal hospital so that we can help animal shelters meet their needs in spay and neuter, and we can help citizens who can't afford or access veterinary care with their medical needs for their animals. We're going to build a training center so that we can continue to train even more animal welfare professionals, but more importantly, what we're doing is in our program of preventing cruelty to animals, let's say fighting animal cruelty, we teach compassion to kids. So when the kids are in schools, we're in schools with them. We reach about 12 to 13,000 a year. When the kids are out of school, Friday night, Saturday, Sunday, holidays, they're here. Summer, they're here. But we just can't keep up with the demand. We could quadruple the number of kids that we teach compassion to. So we announced this statewide initiative in 2015. I had no idea how we were going to pay for it or the strategies we were going to use. We figured all that out, and so we launched it in 2016. Our state has no shelter regulations, no shelter data collection, no shelter standards. So this was really a desert of trying to collect data, reliable data, so that we could plan and develop strategies and tactics. It was hard to assess. So we had, most of the shelters are government shelters, supplemented by some nonprofits that government outsources to. There's about 45 what we call open and mission shelters, meaning the big shelters that the buck stops with them in a county, they don't turn animals away. So in 2016, when we launched it, we just focused on euthanasia rates for these open and mission shelters serving these counties. Now there are 3 counties in South Carolina that don't even have shelters. But in 2016, when we get the euthanasia rate below 10%, and this is collective, this is for both canines and felines, then that's generally considered a no-kill community. And so the statewide initiative, No Kill South Carolina, and measuring progress, 2016, you'll see the green start to appear in different counties through 2021. And so by 2024, we want the entire map green. With where we've gotten in 2021, the beginning of 2021, we announced No Kill South Carolina 2024. We're planting the flag in. That's when we want to achieve it. And it's going to be tough. It's really tough because you know how it is. We're in the red zone now, so you know how it is with the red zone. It's not like you're way back on the 30-yard line and you're on side of the field. This is like, you're down there looking at the goal line, and that's where it gets really, really tough. And that's where we are. That's it. All of the shelters are under-resourced. When we talk about high volume spay-neuter to make impact, there's only about 4 areas in the state that are doing that, and for example, like us, we're doing it, but the more animal shelters can't even spay-neuter the animals already in the shelters. We have to divert our efforts there, and then it pulls away from this public spay-neuter to get that population down. But we've shown it, we can graph it out. We've shown the data, for example, now from the American Veterinary Medical Association, the population of companion animals, canines and felines, will increase with the population of the human population. The human will increase with the human population. Well, let's just take the tri-county area. Let's take Charleston County. Charleston County, over the last 10 years, it has boomed. Let's say we've had a 20 to 30% increase in the human population, yet we've seen that kind of decrease in the animal population. It's because we've been knocking out over 10,000 spay and neuter surgeries every year for a decade. Before COVID. COVID set us back, but we're trying to get back up to that level. And that is the result. I mean, we graph it out. We have this, what we call a community growth chart, human population, and then the canine and feline populations. And as the AVMA said, they were both paralleling each other like that, but then we kicked, when our high volume spay-neuter, 10,000 spay-neuters a year kicked in, it started going like that, just like that. And so, like I said, everything data-driven and research-based with us for the most part.